So we're going to talk about antacids. So I put antacid against acids. We got to think of some ways to, creative ways to remember things. All right. So how does this medication work? It neutralizes the stomach acid. All right. It inactivates pepsin and enhances the mucosal protection, but does not coat the ulcer crater. We understand that? So we go back to what is GERD. What is GERD? It is when that stomach acid comes up into the esophagus. So this medication then says, guess what? I'm going to neutralize the acid in the stomach, where the stomach is not going to be as acidic as it is. And then that pepsin that we talk about, guess what? We're going to stop pepsin from even being activated in the body. Right? Okay, let's move on. So antacids, we have your drug names. We have your aluminum hydroxide, calcium carbonate, and your magnesium hydroxide. So who should take this medication? People who have peptic ulcer disease and people who have GERD. Who shouldn't take this medicine? Anyone with a known allergy. So that is your giving for all drugs. If anybody has a known allergy of a medication, we're not going to give it to them. All right, so now let's take a look at the medications in this class. So aluminum hydroxide, calcium carbonate, magnesium hydroxide. So patients who have renal failure bodies do not filter like it should. So there can be an accumulation of magnesium in the body, which is dangerous. It says antacids can disrupt the electrolyte balance of people with chronic kidney disease. So the biggest takeaway is when a drug is being filtered out, if your kidneys are not working properly, your body will hold on to that drug longer than it should. So with some medications, you need to look at the patient's BUN and their creatinine levels. Administration of the medication. It should be taken on a regular schedule. Some are prescribed to be taken 1 and 3 hours after each meal and at bedtime. Several drug reactions, so do not take with other prescribed drugs within 1 to 2 hours of an acid. So let's say you wanted to take another medication that's prescribed to you. At least wait an hour or two before you take that medication after you take your antacid. All right. Tablets should be chewed thoroughly and followed with a glass of water or milk. So let's talk about some side effects. So brands with magnesium may cause diarrhea. Brands with calcium or aluminum may cause constipation. Rarely brands with calcium may cause kidney stones or other problems. If you are taking large amounts of antacids that contain aluminum, you may be at risk for calcium loss, which can lead to weak bones, osteoporosis. All right? So NCLEX question number 1. Which of the following statements describes the action of antacids? Antacids block the production of gastric acid. Antacids enhance the action of acetylcholine. Antacids block dopamine. Or antacid neutralizes gastric acid. So D is the correct answer. It neutralizes gastric acid.